Hi, everyone. Welcome back to the show. I have my next guest on. Greg, I'm probably going to mess your last name up, but I mess everyone's name up. Is it Vigdor?
Vigdor, you got it pretty much right.
I was close. I was pretty close. I'm proud of myself for that one. Well, Greg, thank you so much for being on the show today. We have some great topics to talk about, especially surrounding the healthcare system and healthcare issues facing America today. We'll talk a little bit about the experiences and the impact of the COVID-19 pandemic, how we can improve our health and our healthcare along the way, and just pretty much what you've learned in your experiences in the American healthcare system. So, Greg, give us a quick background on yourself and how you have come to have such expertise when it comes to understanding healthcare in a nutshell, if that's even possible.
I'm not sure it is possible, but partly I was just born into it. My mom was a nurse. My dad was a dietitian at a hospital. So I started working at hospitals when I was just 5 years old, volunteering. And but I found over time, make a very long story short, a 40 years story short, is I found out that this seemed to be my calling. Try to not only work in healthcare, but try to do something. And the more I learned about the system, the more I learned about how complicated and screwy it was.
Yeah.
And became my career passion to try to fix it in a big way. So I was really fortunate in my career and a lot of different opportunities to try to figure out how to make healthcare fundamentally better for Americans. And proud of a lot of what I did over my career. But when I semi-retired back in 2019, I realized it was still fundamentally still screwy.
Yeah.
And so I started to think about what I could do next to try to contribute to change, and have sort of settled into a new partial career as an author. And I'm trying to write entertaining medical detective stories that also talk about American health policy, why it's screwed up, how we can fix it, and what Americans can do themselves to just take care of their health and improve their family's health.
That's amazing. And your books, how many books do you currently have out right now?
So it's the Irv Tinsley Health Policy Detective Series, available on Amazon. I've written and published 2 so far, and I'm busy writing the 3rd in the series.
Oh, amazing. How's the reaction been from people?
Really good. Really good. I've sold 6,500 books or so, which for a really early author, didn't know anything about what I was doing, is been pretty good. And they've been really highly rated on Amazon. I'm still trying to crack through the marketing maze. That's another whole area of complexity I'm learning about.
Right.
But really feeling really good that people who have read my books have told me they really liked them and they've learned a lot, which is really my purpose, is to try to educate people.
And what is the overall, I mean, you said a healthcare kind of detective, but what is kind of can you give us a quick synopsis of what the book entails?
Yeah, so each book is in its own right a medical detective story of some type, where there's good and bad, and the heroes are trying to solve things that really bad villains are trying to do to folks. But I fold into them book by book some piece of American health policy that most people don't want to read about. It's so complicated, but I try to fold it in an entertaining way. So the first book, I actually use a lot of historical fiction conventions and talk about how American health policy developed over 80 years. The second book, The COVID Murders, I spend a fair amount of time talking about COVID and the experience we had. A little bit of a rant about what happened because it was so screwy and difficult, and still is.
Yeah.
But a lot of it's about what else happened to American healthcare during that time, just in the big picture sense, and why our search for solutions to our problems are even a little bit harder now than they were before COVID.
Wow.
The third will be a little bit different. It's a little bit more about life and death in America. How do we make those decisions? Who gets what in terms of life-saving interventions?
Right.
A lot of sort of fundamental unfairness that people feel in the system when they get really sick.
Wow. Yeah, and that seems to be a constant thing that's happening. Let us know what are the kind of the significant contemporary health and healthcare issues we are facing in America today? What are the kind of the hard-hitting ones that America should be really concerned about or worried about?
Yeah, so just about everybody feels the basic symptoms of the problem. though it's really not the core of why it is. But for just about everybody feels the cost of healthcare in some way. It is just so expensive,
Yes.
whether you're paying the bills directly or they're being paid by somebody else. It's extraordinarily expensive, getting more expensive every year. It's the most expensive thing in our society. When I started my career, and this is back in 1978, the talk was if healthcare ever became bigger than 10% of our what was called the gross domestic product, we'd have this unsolvable problem. It's
Right.
actually now like 20% and growing. So to give you a sense of the perspective of how we've overshot what people years ago thought the problem would be. So
Right.
everybody feels that, but there's also problems with sometimes you can't, and too often you can't get it when you need it,
Mm,
right?
that's true.
There's
Very true.
quality problems. As much as we're proud of a lot of the amazing things that happen, there's still fundamental quality problems. And it's really such a consumer unfriendly system. It's if you just sort of map out how you would make a system that's really about people and say it doesn't feel that way, you'd look at the healthcare system. And those are just the symptoms. More fundamentally, there's things wrong, which we can talk about that sort of get us to why it is that way.
And what are some of the things that we can really do, or maybe our legislation and our government can do to really improve it? I know we've had in the past we have Obamacare, we've had ways to have prescription drugs not cost so much for people. What is it that we can really kind of short term do? Is it talking to our lawmakers? Is it looking at policies and changing things that have probably been in place a long time ago and needs to be changed? Like, what I mean, from your point of view, what do you think that's seriously one thing we can do to kind of improve this and make it a better system?
Yeah, so I think there's generally these two things that we have to do. One is understand there's a policy problem and
Mm-hmm.
figure out how to fix it in a political world that uses healthcare to foster division. So it's
Oh,
really hard to come to agreement on answers. But even
right.
in that box, there's answers. But they want to lose it. At the same time, a lot of what I write about are practical solutions that we can do ourselves, that we should take control of our own healthcare and health and try to do better. And so there's just ways to build on both. The policy answer generally when people ask me about it, and we try to think about it more practically, is we need to put patients and people in the center of the healthcare system. It's an
Mm,
odd system where patients and people are talked more about as clients or insured lives, and
yeah.
it's not just a name, it's actually how they fit. They don't really fit at the center. We're all responding to the healthcare system and what its needs rather than the other way around. And the more that we had policy doing that, I think the more we'd have a system that supported what we should be doing personally, which is
Right.
take control of our health and our family's health and doing the right things to keep us healthy, or taking control of our healthcare visits, making our own healthcare decisions, and not letting the system just say, here's what you get whether you want it or not.
Mm, kind of give you that into all. And I think that's so true because I think it really begins with, if possible, creating a healthier lifestyle for yourself and being able to understand those things. And I think a lot of it too is, and COVID maybe taught a lot of us is that time is precious, time is short, but there's always something you can do to improve your health. And whether it be your mental health, your physical health, it's always steps you can do to take that. And I
Yes.
and I think once you are gained without not knowledge, like you said, and not have the system kind of run it for you, it's a good thing. I do have to say I have seen, and maybe it's this post COVID, that there has been some healthcare, or at least at my job, they have found better ways to really engage you more with healthcare. Where before it was something we still have to pay for, and it was probably expensive and different levels you can do it. They had one plan that was cheaper, but then you didn't get all the benefits, and they had the one at the higher deductible, had all the benefits, but then you had to pay the deductible. But they were trying to find ways to let us know that we have incentives to really help you. And you probably know about this a lot. Is that okay? If you were to walk 3 or 4 miles a day and you were kind of lose weight this and weight, you kind of came in at a certain weight level, but you were kind of journaling your healthcare or your healthy habits over the year, you would get an incentive to kind of um, get a less premium, pay less, what the case is. And I don't know if that's considered bias or unfair for some people because maybe not everyone has that, I would say tenacity to want to do that. But it was always a good thing to see. But I think of people in ages in different brackets. We have people who are either elderly or older who can't maybe have the resource to do these things. And that may be they don't have a computer, or they're not getting this data, or they're getting it from a phone call, or case is, where it says, our younger generation has so much technology to really help them and kind of track these things. Not to say that anyone who's senior can't do it. It's a learning curve. And I don't think they give enough of the resources to really teach people how they could take on these things. And, and that's the thing, a challenge that I like to say is hopefully changing, but at the same time, it's maybe not changing as quickly as we need it to. And the pharmaceutical companies are just ridiculously going crazy with what they're charging for these drugs. And part of me is starting to think that, is it something that costs that much to make? Or is it just they've been doing this for years and they've been getting away with it and you're just left with no choice?
Right. Yeah, so two separate issues there. Let's talk about a little bit about the incentives. It is one of the, I think it's generally positive thing that we're seeing more of these financial incentives for people to do what some companies or people would consider to be healthy behaviors.
Yes.
It's a good thing, but it also suggests that a lot of our thinking about issues as Americans is through money, right? And so, and those things work. Again, the people are behaving better and for their own health is great. But whether it's about money, I think, and it can only be about money, is a big question mark and should be challenged. I would say just about everybody aspires to better health. I mean, I don't know anybody who wakes up in the morning and feels crappy and says, "This is great. I don't want to feel better." Right? And,
I hope not, but you never know.
Beyond that. And so one of the proudest things I created and ran a health foundation for 20 years, and it's still the beneficiary of any of the revenue from my book sales, the Washington Health Foundation. One of the things we did about 15 years ago was create what we called the Governor's Health Bowl in Washington State. And it was this health challenge that we did and hosted for free for people to just get engaged. And you could earn points or miles is what we called it of health. You could do the running and the physical activity things, but you could do it in other ways too. You could get your immunizations, you could get your physical exam, you could engage in working with others and socializing in a way that we know improves health. And we were wondering whether people would engage in this. We had 40,000 people sign up for our first Governor's Health Bowl and participate. That's and all amazing. We had was cheap little prizes because we're just a small health foundation. And it really opened our eyes to, no, people really want to do this. And the more you could make it fun and the more you could reinforce to people that you don't have to do everything to be healthy. Just find something. Park your car further from the front of the grocery store and walk that distance. Right. And you could get points. And again, what we saw was the psychology of people want to do this. They want to be healthier. And the barrier is that the system doesn't really help that and reinforce itself. The money thing tries to do that, but it's not the only way. And there's other ways to connect with people, like you said, who are not as likely to respond to financial incentives.
Yeah.
No, the drug question is no other bag, which is, I think we know generally that Americans probably pay most of the cost of drug discovery in the world. So a lot of the medications that we're paying so much for, it's just ridiculous amounts. That if you've got them overseas, you'd find out you're paying so much less. Yeah. So it's sort of a product of our strange capitalist world in America.
It's just crazy. What was the reality and implications of our national and world experience with COVID-19? What are some of the things that came from that in your eyes of awareness, prevention, or overall a fracture in our healthcare system? Where did you really kind of take that in from, and what was your kind of thoughts on it?
Yeah, two sets of things. One, I write about both of these in my second book, The COVID Murders, but one is just pandemic preparation and response in general. Yeah, people like me had been preparing for the next pandemic for decades, and always under the premise of it's not if, but when. Yeah. Of 1918, we've been engaged with other things that we thought were the ones. I was personally, SARS might ring a bell for people, right? Oh, wow. We thought we had this one when it hit. It turned out to not be as bad as we thought. It was horrible, but it wasn't as bad as we thought it was. Right. But there were plans and there were approaches to what we should do if that happened, and it all fell apart in the face of the experience.
Oh,
in
wow.
terms of the response. There were some major bungles federally, certainly in the CDC, around testing and things like that. But it was
Yeah.
also our society was not ready to deal with the reality of what it means to have a public health response to a highly infectious disease. And it was
Yeah.
kind of stunning for those of us who spent so many decades getting ready for the moment to hear so many people start to say, oh, these things don't work when they do. It's upsetting to hear about a vaccine which was developed in a record time and is one of the safest vaccines that I've ever seen.
Hmm.
And I was always looking for the ones that weren't safe. To then suddenly hear it's so bad.
Yeah.
So it just really fell apart in terms of that. And I still question our ability to handle the next pandemic if it happens too soon or ever, in terms of just what happened and the memories about our COVID response.
I
But
think oh, go ahead. I was going to say, in response to what you just mentioned there, was that do you think it was a matter of supply and demand? Because I do remember at times, and I was in New York City at the time, it was so hard to get vaccinations. It became such a power move, or people who had money or status who was able to get these things. And of course, you had your naysayers about it, but people who really wanted it couldn't get it. And it was almost to this point of like, if we were preparing so much for, or at least we thought we were preparing for in the way we should have, and the vaccine coming out, and obviously it's coming out, they're bringing out as much as they can. I think it was so hard and disheartening for people to think that they couldn't get it, and then they just felt like if they didn't get it, they're going to die. And sadly, that might have happened for some people. Others, it was just a kind of a widespread kind of, you know, hysteria that people were putting out here, and it became this conspiracy theories and everything else that came with it. And you're just kind of like, how do we even manage that? How do we even just find ways to do that? And then reassure people that it's okay, because some of the healthcare people, and no disrespect to them, but like it was overwhelming for them. And so you both have two parties, one trying to administer a drug and help you, but yet you have the public who is hearing from different many people, Dr. Fauci and whoever else, and saying, if I don't get this, I'm going to die. And it's like, it's not the case. But, you know, ideally, we need to take the steps to do that. So it was caused, this whole level of hysteria just made things so much harder. And I just wonder if that's something that we just don't want to repeat again. We don't need to repeat again. But also, how do we stop that? And I think that comes from our higher ups that really showcase that.
yeah, I don't know what we do in the future about it, because it's also just about social media and how people get information. But it was
Yeah.
all over the place. You had
Yeah.
people who were saying, I can't get it. There are other people who could get it, didn't want it, and needed it.
Yeah.
And everything in between. And it varied from state to state, community to community. So
Sure.
what you were watching on TV and your national news might not be reflective of anything really going on locally, but no one could connect those dots. And no one was really trying to connect those dots. And it
No.
didn't seem that many people were interested in connecting those dots. So it just
Not.
became sort of mass hysteria and sort of like what you heard on the bus. Not that anybody was riding a bus back then. And that's not the way to manage a public health response. We showed that in 1918 with that pandemic.
Right.
And I thought we had learned a lot and were prepared, and we were not. In many respects, it was worse than our response in 1918.
And it's just crazy because I remember times that it was, as you talked about your local news and regions, it was so different to see how that response was different, so many different places. So, in New York, okay, we were taking it serious as we were doing these things and masks and, all these things. But then you would go to Florida, nothing against Florida, but it just seemed like it didn't matter. It's almost like it was like you're in a place and it doesn't even exist. And you're just kind of seeing these different realities happening in the current world that's happening today. And it was just kind of like a shock of like, there's something going on, but yet, you don't care about it. It's fine.
Yeah.
It was just crazy mind bending how that all worked, or the heat would just get rid of it. And it's like, I don't think that's how pandemics and, respiratory diseases work. I don't think heat is going to get rid of that, but it was just kind of sad to see, like you said, that level. But I just think it was just a lot of, like you said, social media and miscommunication that kind of derailed it. I mean, I think there were some good points that were being made. Like you said, it wasn't as bad as some of the earlier ones, or I'm not saying bubonic plague or the Black Plague and all these other grand plagues that happened throughout time. But I do think it probably could have been handled a lot better. But I think a lot of politicians got way too involved and made it way too messy, and not made it very understandable for all people to really get a grasp of what was happening. Or
Yeah.
do you want to blame someone else, ideally, for it? Well, they don't want to take their own blame for it, but we'll blame some other. Oh, we'll blame China because it came out of China, or it's something that we don't have to deal with. But it's a global thing. You were seeing this happen around the world. It's
Right.
almost like you have to get outside of your comfort zone and outside of what you know and realize this is not just affecting you. This is affecting everyone around the world.
Yes. Yes. When it connected to the politics, that was basically when became a problem that wasn't going to be solved.
Yeah.
And I said, my hope for the future is that the politics in this country start to tone down a bit, but that's not happening now, and I don't see it happening for a while.
No.
So we better hope we don't have a pandemic until that happens, because we saw that you mix the two, and you end up in some very bad places that aren't really good for anybody.
No, not at all. And a little bit more about, you talked about your foundation. What is it that you would kind of advocate or tell people to help them improve their health or their healthcare? What are some kind of maybe quick tips you could let some people know, and the viewers know?
Yes. So some of the other great work the foundation did was something we called Create Your Own Health Home.
Okay.
And we did, this was 15, 20 years ago when we started this work. And so we set out about, well, how do you actually help people empower themselves to be able to take control of their health? And we developed a whole series of what we call health home tools. And they're actually available on our website still. But they're just these simple tools that people can download and use that tries to insert them in a more powerful position in terms of the relationship with the healthcare system in particular. So for example, one of our first health home tools and really well developed was for people going into the hospital as an inpatient. And you come in and you just kind of move around and you're not sure what's going on. Well, we created a guide that people could use and download and sort of fill out, and they have it with them in the hospital. So they can even put, like wrong side surgery used to be a real big problem. It's less so now because there's more standardized methods. But it was that, well, you can sort of put this, thing on that says it's this arm you're going to be working on, not this one.
Right.
Just practical things like that. We have another one that's a health home tool. That's if you have a primary care visit with, and you're going in, and it's typically we don't have the same primary care physicians because we're moving around from provider to provider because of insurance.
Yeah,
and you're kind of embarrassed by what it is you really want to go in and talk to them about. But then you sort of find out that your visit is on average like 7 to 8 minutes long. And by the time you've gotten to your 7 or 8 minutes, you haven't actually mentioned that thing to the physician. And they're actually literally walking out the room. And you're going like, well, wait a second. So let's say it's like a sexually transmitted disease or something embarrassing like that. Well, the form says it's a 1-page form. You just fill it out. Why are you coming in for this visit? And you go 1, 2, 3. If number 1 is sexually transmitted disease, the physician would look at it and go like, oh, that's what we're going to talk about.
Right.
So again, that's not the way most primary care visits work in reality. So the tool allows you to reestablish a relationship to that. Again, we have like 30 of these tools, but in principle, they're all about saying that I'm in charge of my healthcare. These people are here, a part of my team. It's not the other way around. I'm not here to just say, you've diagnosed me in your 7 or 8 minutes, and now you think I need this when I came in for that.
Right. And that's good, because I think, maybe some people are afraid to maybe speak up to their doctors and, be misdiagnosed or have those frank conversations, like you said, because it's like you said, it's kind of a turnaround system. I remember blatantly, I've been pretty much a healthy person for the most part, but, you have to do your annual checkups and here and there. And I remember, I think I got sick, maybe had a cold or something. And I remember it took almost 2 weeks for me to get another appointment to check in with my doctor because he just was that busy. And there was no nurse that can help and do cases. But now I think they have Vice Nurse now. They have different avenues you can go to, or telehealth now is a new one, to have these questions, or your local clinics. But once again, it came down to money and factors, because if you didn't have this level of insurance, and, they'll give you a receipt after whatever you had going on, or practice, whatever drugs. And if it wasn't for insurance, and like I said, I'm glad I had it, but I think people who don't, it's almost like $1,000-something or something. And like I said, that could vary from place to place. I'm just talking about New York City, but just imagine, the simple fact of how much it costs just to get some care for something that's so simple.
Yeah.
And the response times that you have to go into, it's almost like it's like a hierarchy of levels. Do I go to my doctor? Do I go to my clinic? Do I go here? It's just a lot of things that people sometimes, I can see, probably get very confused about that. But the tool you're saying makes it sound really great, because then it's like you are arming yourself. You kind of have to go in with that, and you know how to really navigate that, which I think is a good thing to have, because people can get intimidated. You think your doctor's telling you right, which is what we all assume is right. You assume they're ethical, but we do know that's not always the case, and you could be taken advantage of.
Exactly.
Especially with the elderly, I see it happen all the time, and it's just so sad to see that.
Yeah, it's confusing. You're afraid. You're uncertain. One of my best examples of all this is myself, because I've been in the field for 45 years. Yeah. I'm not a clinician, but I know a lot of clinicians. I spent a lot of time trying to figure out how to work this best. When I have my experiences, I get confused and uncertain. What does that say for the average user if after 45 years I'm still scratching my head going like, this didn't work the way I thought it would? So that's just clearly something wrong when it's kind of, you're talking about a system where even people that are expert in it find the experience itself different. One of the statements in my career that got through me the most was when I'd be sitting with hospital administrators, the CEOs of major hospitals, who start talking about an experience where maybe it's their wife suddenly got a really dangerous disease that threatened her life and had to use their own system to get care. Wow. And what they had to say about it and how astonished they were about how difficult it was to engage and understand what was going on. These are the people running the facilities who couldn't get enough answers to make it work for them. I think that sort of diagnosis exactly what's wrong with American healthcare, that it's really not built to help people engage. It's the other way around.
It's the other way around. Yeah, that's so true. And, you just talked a little about your experiences, but can you tell us some other experiences you've learned in the American healthcare system? And how do you compare that to maybe some other healthcare systems around the world? And is that something that we can probably replicate or find commonality in?
Yeah, so when you start putting it on a national scale, I've done some traveling, and I've actually tried to look at other systems in other countries, try to understand it. And I think the one that jumps out the most for me when I've done that is the sense of unfairness that we have in America about what happens. And some of it is we were in our two industrialized nations in the world that don't have a system that covers everybody. We've gotten a lot better with the Affordable Care Act amendments and Medicaid expansion, things like that. But there's still millions of Americans who don't have any health coverage at all. You go around the world, pretty much every other country, everybody is in the system in some way. There's some publicly embraced system where everybody can get into it. And then it varies, but many of them have a way where you can buy in and get more care or different care outside of the public system. Wow. And what I found when I go out and sort of talk to folks in those countries about that, they actually thought that was fair. And most of the people I talked to, it was like, well, I can get something, and maybe rich people can go get that thing and it's better. But I guess if they got money, they should be able to do that. In the United States, it's not that way. It's sort of, there is this fundamental unfairness that people feel. And that starts to flow through the craziness of our system in lots of ways, where there's a backdoor solutions for it, such as people being able to go to the emergency room and maybe get sort of care, or if they're about to die, care, but not to really solve their problem.
The problem overall,
Or we see ways that hospitals are cross-subsidizing the free care that they have to provide to people coming in through that door or some other doors to the people that are paying. And suddenly, who's going to pay those cross-subsidizations and who's not? It's really, this unfairness is inherent in our system. And one of the core problems beyond the symptoms I was talking about earlier that we kind of really got to get a handle on, because unless we feel that it's more fair, we're always going to have some real problems with it in America.
Yeah.
It is unfair.
Yeah. And, I looked at the British healthcare system because I went over there a couple of times, and I only think I got sick one time. And it was so crazy. And that's the one thing you don't want to do when you travel, is get sick abroad. It's like the one thing you don't want to worry about. But I did find it to be so relaxing to know that they were taking very good care of me. And they seem to really take care of their people and don't charge an arm and leg for stuff. And I come back home and I think it's the same medication like you just mentioned, and it's just it boggles my mind how we do this. And it's this whole precedence of let's do our part and make sure everyone's insured, but let's charge them arm and leg so they can't afford this and that. Or cases like it's almost like they don't think inflation exists, or like it's not a thing. Like it's like it's just ridiculous, And I do think there are parts of our American healthcare system that are great, but I just think that we are just skins left, like you mentioned earlier, this greed and capitalism that's just taking that away from what it means to just genuinely care for someone and take care of someone and to help them not get in that same place again. One of the main things is like when you get healthcare, at least how I see it, is that, okay, you got sick. Some things are unpreventable. That's understandable. Or there's some things that, you take the time to say, hey, if you don't do this, you don't eat this right, this can happen, or this is what can lead you this way. And educating you in that process of doing that. I just feel like you don't see that a lot anymore. It's just not given to you on I wouldn't say daily, but maybe just like an obvious place of what you should be getting when you think about your healthcare.
Right. Yeah. It's harder to find. And what I've always found the strangest about the system was that I've worked with thousands of people over my career in the healthcare system, physicians, nurses, other healthcare practitioners, many of the administrative people, almost all of them. I'd say like 90% of the people I've worked with are caring, compassionate, smart, committed people who feel at many times stuck in a system that doesn't allow them to be their best caregiver.
Yeah.
And that's not right. And they're looking for solutions as well as the people who are not getting the best of the system. And at the same time, this system does astounding, miraculous things on a daily basis to save people's lives and to improve lives. So we're just dealing with all these contradictions that make somehow getting your arms around it and fixing it just even more of a problem than we thought when we dig into it. That's what I'm trying to help with my books, is try to simplify the conversation and compress it so we're just not all over the lots and letting politicians sort of frame out our choices.
Right. And I'm assuming, like you said, their response has been great. It's like people can really relate and understand to the stories and the characters, but also realize it's not, like you said, it's not overpowering. It's not something jargon that you can't understand, because there's a lot of healthcare jargon I don't understand half of it. It's like, my doctor's pretty good about it, and I'm very glad to have him. But like I've had doctors before where they're just like, yeah, take so and so, this and that. I'm like, I know you have a sense of what you think you're saying, but you're not explaining the way that the common person should understand and do it, and it's almost like a well-run machine at sometimes, but we definitely get better about that. So that's kind of great. You definitely have things out there for people to do that. I'm trying to think, when we look and move into, well, we're already halfway into the year now, and then we have a crazy election coming up for us. Do you have a fear, Greg, that our healthcare system is going to go through another round of political propaganda, or a level of, we're going to toy with this and debates and see how we can get the American people to get on our sides, but yet really not fix anything in an interim, and it'd be the same exact thing that's going to happen?
Yes, I'm virtually positive that's going to happen over the short term, that we're going to have, once again, this Affordable Care Act, Obamacare debate among our presidential candidates, and it will flow through all the other elections. So I have no belief there's going to be much progress or much even intelligent conversation about this till after the election. And then depending on how the election goes, we could find that once again the Republicans sort of look at the issue and say, we don't want to touch it, and we'll sort of be in where we are still today. And same with the Democrats. But I do believe that at some point we've got to get through the politics of it and into a place where we're going to find consensus solutions. A lot of the work the Washington Health Foundation was exploring whether Washingtonians, but I think you can call them Americans too, whether there's an appetite for consensus solutions that are outside of the typical choices from the political parties. And what we found was a resounding yes. And that if you instead explored more things around values like fairness, that we would find people willing to come together and recognize that, well, their views of fairness might be different, but we can compromise those, where some of these talking points politically we can't. So I think there's an appetite out there in the American people to find these solutions. The politics doesn't match up, and we've just got to get to a place where those things can come a little bit closer, and we can actually do some things that will sort of be more enduring and better.
Yeah. Yeah. I hope that's the case. And so your third book, do you have a time frame when that one will be released?
I expect to publish it summer, early fall. September 1 right now is the target.
Okay. That sounds amazing. And do you have any insight or anything you want to let us know what it's going to be focused on?
Well, it really is around end-of-life care in America and some of the defects in our policy there, but it's also about life-saving technology and how we distribute it. And again, getting at this fairness question. One of the windows into this is actually something I wrote about in my first book. In that book, some of the leading characters actually passed major health reform in Washington, D.C., but with a very different set than typically you would see as far as solution packages. And one of the 10 points in that was that there would be a national healthcare lottery. So that if, let's say, there's some miracle cure for cancer that you can get, and it costs like $100,000 a dose, sort of, well, who gets that? And the National Healthcare Lottery in my legislation, fake legislation, basically says, well, if you could pay for it, you can get it. But for everybody, you can enter a national healthcare lottery where you can get it if you win the lottery. And my thinking of that is, it's not, the odds would be better than what you get from the lottos that everybody plays every week.
Right.
I tell people that, so they go like, well, that doesn't seem right. And then I go like, but everybody loves the lottery. And they're going like, yeah, they actually do.
It's very true. It's very true. Yeah.
And then I say, I bet it's fairer than the way we do it now. And they go, that's actually probably right. So I'm trying to build that type of thinking into this next book to sort of get to this, that if a game of chance is better in terms of fairness than our current system, don't you think we ought to fix it?
You would think so, right? You would really think so. That's crazy to think that we don't. Oh, man. Well, Greg, this has been so great and so powerful. Now, let us know, where can people find out about your foundation? If people want to know more about their health or how to take care of their healthcare needs, where can they go get more information?
Yeah, so the Washington Health Foundation, we're not doing much aside from me writing books, but it's the Washington Health Foundation. It's washhealthfoundation.org, pretty easy to find on the internet. And there's just a website there with a lot of different pieces of our work, and you can find in some of our tools and resources, the Health Home tools.
Okay.
My books are available on Amazon, and it's easy just to go to Greg Vigdor on the Amazon site, and they'll get to my homepage. And it'll also, I think, link you to other places. You can read the reviews and check out the books and see if they're something that might be of interest.
Perfect. Well, Greg, once again, thank you so much for talking with us. I really appreciate it. It's been a really great conversation, and I'm wishing you all the best and success, and looking forward to the next book, and hope all is well and stays well.
I enjoyed the talk.
All right. Have a great day.
You too.